Welcome back to the Patient First podcast again. I'm so happy that you're here. I get all sorts of feedback from wonderful dentists and dental team members across the country and frankly around the world now. It's amazing how some podcasts, we're doing really well in Argentina and in Peru. So thank you, all of you who are listening outside the US too. It's an honor to be talking with you. And today I think we're hitting on something that any dental team can learn about. Now, taking a step back, like I said, lots of dental team members reach out to me on a regular basis. And right now, talked about it a few months ago, if you've been paying attention to the podcast, that I felt like we're going to be smacking hard into a wall of lack of profitability in dentistry. Why? Because expenses are going up, inflation's out of control, wages are out of control, and guess what? Reimbursements are going down. Makes no sense, but that's where we are. And we're hitting, by all accounts, I just saw that one economic group raised the likelihood of a recession from the low 60s to 100% chance of recession. Now, I am not an economist. I just like to read the headlines, and that is a headline that I think we all need to be paying attention to. So, what do we do about it? How do we positively affect profitability of our practice so that we don't get slapped in the face with no profit? Right. And I think there's probably a lot of people right now, maybe you're new to the podcast, that this is relatively new and you're looking at how I'm so busy all the time. Where is the profit? Where is my revenue at the end of the month, at the end of the quarter, at the end of the year when I get my tax bill? Holy man, there's no money left to pay my taxes. What's going on? What do I do about it? Well, my friends, today, hopefully, I will show you the way. And first, let's talk about what the way is not. Most people, when they think about how am I going to grow my practice, how am I going to be more profitable, boy, I should really do these expensive things like create paraffin wax in my practice or do massages or beautiful artwork or put a fountain in my reception area. Then people will love me and they'll want to say yes to all the treatment, right? Absolutely not. Giving people free goodies and cookies and stuff, it's niceties, but it's not. I hate to tell you, that is not what's going to go to your practice. It would be so great if you do it, right? I mean, how great would it be if all you had to do was to do these like extraneous things and have your practice flourish, right? If you gave away cookies and suddenly people said, oh, I want to do all the treatment that you're talking about, it would be so much easier than the way the world actually works. How does the world work? Well, people are freaked out when they come to see us, right? Focus on where the breakdown happens, which is here. People aren't walking in your practice going, man, I would do that implant if only they would give me a cookie. I mean, it sounds silly when I say it that way, but that is what some consultants say, right? Oh boy, if you have great coffee, which, I believe me, I wrote a book, The Patient First Manifesto. The first part is about how somebody comments on the great coffee in my office. So I'm not discounting the fact that you should have niceties in your practice, but that's not what's going to truly grow your practice. We want to focus on where the breakdown happens, right? And I'll talk about why in a little bit. But for most people, the bar where the practice breakdown happens, where that happens is one thing and one thing only. It is convenience. Now, I would include convenience to include anxiety, right? So reducing people's anxiety, of which cookies can help with that. But convenience is a big thing in dentistry that I think overarching many practices are missing. Not convenience for you, convenience for the patient. As Marcus Aurelius said, one of probably my favorite philosopher, I think he's phenomenal. He said the impediment to action advances action. What stands in the way becomes the way. What does this mean? It means that the obstacle that is getting in your way becomes the way, as Ryan Holiday wrote about in his book, The Obstacle is the Way Too, which is basically just a detailing of this idea, right? What does that mean? How do we actually put this into action? Not just looking at big picture, meaning convenience, meaning making painless injections, right? If you grow your practice just by looking at convenience and pain-free injections, I think that's not a bad way to go. You'll grow a great practice, I believe. Lots of people who love coming to see you if you focus on high quality care, pain-free injections, and delivering patient care to a way that is convenient for patients. Right there, full stop. That's basically what my first book is about. It's about how do we deliver convenient care for patients in a way that grows your practice. But let's take it a little layer deeper. Let's go down to your practice, right? How do you actually take this type of philosophy of what gets in the way is actually how you, how you reach success, right? The barriers to success actually unveil the keys to your success. And it's by looking at things very, very cleanly and simply so that you can identify the obstacles. Like this. This is Toothapps Intel, which is a product that I helped create. I'm co-founder of Toothapps, and Intel is our analytics platform, which really just simply like this, like ABC. You can see it says profit equals income minus expenses. And of course, we tell you what the profit is, whether it's gone up or down, right? But why is this important? Because a lot of people today are looking at profit and going, where is it? Right? I produced a lot of money. Where is it? Well, I'll tell you right now, in this month, when profit and expenses were the same, there is no profit. And you're going, look, this is one of the highest months of the year. And this is a real practice, by the way. It's anonymous, but this is a real practice. They hit here where the profit and the expenses. Now, what happens if the expenses go above the income? Oh, well, then, my friend, guess who's putting money in into the business, or your bank account goes lower. Now, I've had that happen where I've had a monster month, produced a ton, and then I look at it and I have less money in my bank account. You need to have a software platform that can plug into your practice management system to pull your production, but also into your accounting software to pull your expenses. Otherwise, you only have half the story. The obstacle becomes the way. And if you have no profit, you look here and you go, why? What's the problem that we're having? The problem with this practice, frankly, is expenses are too high. Now, you can go a little bit deeper and see why are they high. Chances are could be wages, which then we maybe need to produce more, or else we need to reduce, right? So again, it's not so much that these numbers matter. What matters is that the numbers tell the story, and you need to have the information so you can unveil what that story is. Another way that you can use numbers like this to show you the obstacles in your practice that then show you the way to profitability is case acceptance, right? Look at these case acceptance numbers. Now, what I'm showing you here, for those of you who aren't listening or not watching the podcast, but Dr. Kate Miller, again, this is fake. So we didn't want to use anybody's real names, obviously, but Dr. Kate Miller has a 72% case acceptance, which is around average, right? But what's more telling is that Dr. Miller, working with hygienist Tom, has 100% case acceptance. That's amazing, right? 100%. And frankly, the highest dollar value in this case, which is based on a real practice, not real numbers, not real people, but this is directionally aligned with a real practice, versus Jeff, Tom and Dr. Miller together, 100% case acceptance. Dr. Miller and Jeff together, 46% case acceptance. That, my friends, completely sucks, right? That's a problem. That is a problem, right? If I'm Dr. Miller, Jeff and I have to figure out where's the disconnect, right? And then Audrey on the bottom has the average exactly of 72%. So we know where the issue is, but if you don't have the numbers, you don't know the problem. The obstacle is missing. And if the obstacle is the way to increase Dr. Miller's case acceptance here, then we have to identify the obstacle so that then becomes the solution. The reason why Dr. Miller here has a slightly less than average case acceptance of 72% really isn't Dr. Miller. It's Jeff. That obstacle is Jeff, and turning Jeff around or turning Jeff out and replacing Jeff will be the way for Dr. Miller's case acceptance to go up. You don't know if you don't know. So if you want a trial, hit me up, like, subscribe, comment. We can get your numbers for you exactly. Go to toothapps.com and you can find out all sorts of information about your practice, why patients are leaving, your case acceptance, the valuation of your practice through Intel, because we have, again, there's some key metrics in your practice that you need to look at. And I believe that case acceptance is one of those. Valuation of your practice is another, so that you can become more profitable. But if you're not looking at it, you don't know the obstacles that it can actually lead that the obstacles once removed lead to your success. The answer to problems are relatively simple once you know what the problems are, right? You can't answer a question that you don't know what the question is. Once you know the question, you can find the answer, really. It's another way of saying the obstacle is the way. And to identify those obstacles, hit me up. If you're having issues with your profitability, I would love to help you. Like, comment, subscribe. Let me know if you have insight to these numbers in your practice, how you do it, and if not, why you don't think they're important. I'd love to communicate with you that way too. So, of course, as always, thank you very much for your time. I look forward to talking with you next week on the Patient First Manifesto.